Finally, let's welcome Perry Allen of Novant Health Brunswick Medical Center. Well, welcome, Perry. It's so good to have you on the show.
June, thanks for inviting me. I was excited to come and speak with you.
Well, good. So for our viewers who haven't met you, because you're always in the pharmacy, so a lot of our viewers probably don't know you, share a little bit about your background and your education.
Okay, June. It's been a while since I've been on the show with you. But,
it has been.
Yeah, it's been a few years. But I grew up in western North Carolina, a little town called Morganton. I went to Chapel Hill for pharmacy school. Got my bachelor's degree in 1993. And then I went on to get my doctor of pharmacy in 2000. But during that time, I'd started my job at Brunswick Medical Center back in 1993. And
those are the old days, right, Perry?
That was the old days in the old building. I actually was a pharmacy student intern at Brunswick when I came down to Wilmington to do my internships.
Wow, I don't remember that.
Yeah.
Oh, it seems like you've always been there to me. So, how many years have you been at Brunswick?
Almost 28 years now. It'll be 28 in May.
Wow, yeah. 28. Huh. Almost long as me.
Yeah,
longer than me.
When did you come?
I came in 99.
Okay, so yeah, 4 years. Yeah, I came down as the student and I fell in love with the area and just didn't want to leave. So I've been here ever since.
Well, that's awesome. Well, tell me, I know I have mine, but tell me some of your favorite memories of the old days at Brunswick Community Hospital.
Okay, yeah, there's been a lot over the years. One of them we were just reminiscent about was one day when the roof blew off of part of the hospital over in our women's center department, and the rain was pouring in, and we were trying to move the patients, and we were moving the meds out of there, and it was an event for sure. Back in 2006, Novant Health took over the hospital, and that was a whole burst of new energy in the community, and that was exciting. 2011, as you know, we moved into our new building.
Yeah.
We had this major, move from the old town to the new town, and the patients got transported, and all the supplies and the medications were all moved. It was a huge endeavor, but it was well worth it.
That was exciting. It was so foggy that morning when we moved those patients. Do you recall that?
I do not recall that. I was inside to the end.
We took pictures outside, and it was so foggy that morning.
Yeah. Oh, and then, of course, Hurricane Florence a couple years ago.
Yeah.
We were stuck in the hospital for 7 straight days and nights, sleeping in
Talk about quarantine.
Oh, my goodness, right? We were getting prepared.
We prepared for this. Well, this has certainly been an interesting year with the pandemic and all. How has that affected your pharmacy team?
Well, back at the beginning, we were, nobody really knew what was going on. And
right.
We split our team into an A and a B team, and we were doing 7 on and 7 off. So we kind of minimized the number of people that were coming into contact with each other.
Yeah.
We allowed some of our pharmacists to work remotely. They could do a lot of their order verifications and a lot of their clinical reviews from a remote computer at home. So that was helpful. That was the biggest impact. And then, of course, over the last 4 or 5 months, we've been having to bring some of our team over to the vaccine site to help prepare those vaccines for our community. Yeah.
You mentioned vaccine. How fun was the day the first shipment of vaccine came to the hospital? What was that like?
That was pretty exciting. I got a text that said the vaccine is here, and I got down to our loading dock, and there was people everywhere. They were all celebrating. It was a big party down on the deck when the vaccine came off the truck. Everybody was clapping and applauding. We had public safety escorted in the vaccine all the way to the pharmacy. And a little later that day, we marched the vaccine down the hall to our room we had set up and started administering it to our team members.
Yeah, that was a day of celebration.
It was, for sure.
So how have you and your team helped the community to understand and talk about concerns and fears of the vaccine? How have you and your team handled that?
Well, we've been out at the vaccine clinic every day with the vaccinators, and we do periodically get questions from
people
who are, maybe they're just a little hesitant or or they've got another medication they've taken and they're not sure if it's compatible, or we have to figure out the timeline of when did you get another vaccine, or did you have COVID in the past, and when was it, and how many days ago. So we luckily are there, and we can walk out and talk to those patients when they have those questions and try to put their mind at ease that it's okay to get it.
Yeah. Well, if we have viewers at home who are, they haven't received their vaccine yet, and they're a little apprehensive, what would you say to those folks? Any words of encouragement?
Absolutely. Yeah, so if you think about it, the vaccines that we're administering now are highly effective, amazingly effective, really, for the percentages of patients that it works. While there is an opportunity for an adverse effect or a bad side effect, it's really rare when you look at the millions and millions of people who have received the vaccine and the few that have gotten serious complications from them. And it helps out our community. It helps you out and your family and your friends and your neighbors. So I always like to encourage everyone to get the vaccine.
Yeah. Well, how do you think the response from the community has been with the vaccine? Do you feel like we've had a great response?
Oh yeah, it's been overwhelming. We've been working out in the
Right.
parking lot.
We've been out there together.
Yep, we've had thousands of people coming through the clinic. Everyone is in a good mood. Everyone's hopeful. So many people bring food to the team. We've had so many sweets and cookies and candy and chips, and we have.
And there have been some local community members and organizations who have provided lunch to us, in addition to the county who's been providing lunch. I mean, it's been a tremendous outpouring of comfort, and everybody's been wonderful. And as you said, everybody's in a good mood.
Yes.
They're happy to get it. They're proud.
Exactly.
They wear the badges of honor.
Yes.
Yeah.
Yes. And we've gotten to partner with the Brunswick County Health Services and with Dozier and with some of the other local health communities and organizations. It's been a really unique community effort.
It's very unique, I think, to see that many people and that many organizations and companies to come together for once and to agree that this is really important and we all need to do this together.
Absolutely.
I think it speaks volumes of the community that we live in.
It does.
And the people that are surrounding us in Brunswick County. Is there somewhere that the community can go for more information on the vaccine or just anything related to the pandemic?
Absolutely. Novant Health has resources available on our website for vaccine information, and you can also contact your primary care provider to get some information on how and where you can get your vaccination. If you haven't gotten it yet, there's still opportunities to do so, and you can still find those resources. Yeah.
I think I saw one website, it was getvaccinated.org, and there's lots of information on that.
Yes.
Well, it's really been a pleasure having you back. It's been so long since we've been on the show together. And I'm hoping that these days are coming to an end and we can quit wearing the masks.
Yes.
And, but until it's time, we're going to continue to be safe.
Absolutely.
Yeah. Well, thanks again for coming, Perry. I hope you'll come back real soon.
Thanks, June, for having me. I've enjoyed our time together.
Thank you.